Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question by my patients: how to get rid of those fine lines under your eyes. And so in answering this question, it's worthwhile talking about what are these lines. Well, there's three principal types of lines. There's dynamic lines or dynamic wrinkles that are associated with movement, and those are particularly around the corner of the eyes, sometimes called crow's feet, particularly between the brows, where sometimes they're called number 11s, and of course on your forehead. And these types of lines are best treated with Botox, and Botox really helps with these dynamic lines. Then we have static lines, and these are fine lines in the skin which can be related to aging, can be related to having genetics and thin skin, and it can be wear and tear changes in the skin. And then finally, deeper lines, and these deeper lines may run from the nose to the mouth, where they're called nasolabial lines, or they can run from the lips to your jawline, where they're called marionette lines. And these deeper lines, well, it's often a combination of gravity, descent, and also facial aging. And so often that volume loss that's associated with facial aging might need either non-surgical treatments such as fillers or surgical treatments such as lifting your face and facelift surgery in order to restore the anatomy to where it used to be. But principally today we're looking at like those static lines, those lines under the eyes that tend to be there all the time, but particularly relevant when you smile. Now, how to prevent these fine lines? Well, there are four basic areas that are important in this area. Wearing sunscreen to protect your skin from sun damage. Various number of eye creams can hydrate the skin and improve the quality of your skin. Healthy diet and hydration are very important. And then, of course, we have cosmetic treatments. So how to get rid of these and prevent these lines? Well, sun exposure, protecting your skin from the sun, this is very important. Eating a vitamin C rich diet, well, that's evidence that can improve things, as well as topical application. Hydration is very important. Avoiding smoking, that can really damage the skin quality, particularly give you fine lines under the eyes. Stress can also be a relevant factor, and we can really use a combined approach to improve these fine lines and skin quality. My name's Dr. Julian de Silva. I'm an oculofacial plastic surgeon, and fine lines around the eyes is something that I manage with so many of my patients every day. This cannot construe a medical consultation. It's really for information purposes. So in terms of these fine lines, well, there really are 7 reasons why you can get these fine lines. And firstly, it can be because there's dead skin cells and you're continually losing your dead skin from the body. It could be related to low collagen. It could be related to low hyaluronic acid within the skin, smoking and other environmental factors such as sun exposure, dehydration, and of course cosmetic treatments can be used to improve these. And so we're going to talk about each of these elements in the next few minutes. So in terms of dead skin cells, well, you're continually losing your skin, and that is a barrier for infection and hydration, but dead skin cells tend to accumulate, and so exfoliating, using good skin products, cleaning the skin, those cleansers will also remove some of those dead skins, and that will improve the quality of the skin under your eyes. Low collagen production, well, an element of this is genetics, and some people tend to have hypermobility, and that means your collagen is just made slightly differently. And one test you can do is see how far you can bend your thumb towards your wrist, and if you can bend it almost towards where your wrist is, you've got hypermobility, and that can mean your collagen is more stretchy, which unfortunately is not so helpful in terms of aging, as you tend to age faster. And many of my patients who come to see me from their kind of mid 30s to early 40s, over 90% of them, when I do that test, they have hypermobility. And that's very important when considering different treatment options, because often those patients are going to need more surgical intervention to get the results they really want. There's also changes with age, and with advancing age, you tend to have less quality collagen in the skin, and of course that tends to give you more fine lines under the eyes. Low levels of hyaluronic acid, well, we know that we can enhance hyaluronic acid in the skin, and that can really rejuvenate the skin. And of course, there are fillers that can do this, but there's advanced techniques such as Profilo that hydrate the skin by adding hyaluronic acid to the skin. And these have been really an effective way of rejuvenating this area. Smoking, unfortunately, really damages the skin. Smoking reduces skin quality, increases the number of fine lines on the skin. So really, if you can reduce smoking or stop smoking, that will really improve these fine lines. And it really causes damage on a number of levels in terms of reduced oxygen, collagen breakdown, and it just tends to wear and tear the skin much faster. I have a person that I am able to refer patients to help stop smoking, and I have many patients who've been able to stop smoking over the last few years. So if you're based in London, you'd like that contact, please do not hesitate to get in touch with me. In terms of sun exposure, well, under eye wrinkles, well, they can really be exaggerated by sun damage, and so the ultraviolet light damages the skin, and so really wearing sun protection factor, avoiding sun exposure in this area will preserve the skin in this area. And it's worth wearing sunscreen every day, because even when there's not sun that you can see, there is ultraviolet light that's causing fine damage to the skin, and over periods of years that can really damage this area. Hydration, well, drinking 3 liters of water every day is very helpful in improving your skin quality. And it's well known that many models will drink more water in order to improve the glow of their skin and hydrate the skin, as that can improve their appearance. Well, we also know that has multiple benefits on the body in terms of general health. So drink 3 liters of water a day is very helpful. In terms of cosmetic treatments, well, really there's a spectrum of approach here depending on what you need. Now, botulinum toxin or Botox can be really helpful for those dynamic lines and patients with very fine lines under the eyes, particularly with smiling. That's a very kind of advanced technique, putting Botox under the eyes, because you need a tiny amount of Botox, because too much can cause the eyelid to droop. But it can be really helpful in some patients. Resurfacing the skin, the milder form of that is chemical peels, but the gold standard is a CO2 laser, and I have a gold standard laser in my clinic that really can help with these kind of fine lines, not just around the eyes, but fine lines around your face generally. Skin treatment, well, retinol, although there are a number of different skin treatments, including antioxidants, vitamin C, really retinol is a powerful ingredient that does really improve skin turnover and improves the fine lines under your eyes very specifically. And there are a number of tips I would give in terms of using retinol, because your skin can be quite sensitive to when you first start using retinol, and it's worth starting slowly in a lower concentration in order to reduce pinkness and reaction. But if you can tolerate retinol, it will make a really serious difference to you over a period of years. And some of the patients who come to see me, well, sometimes they can look even 10 years younger than they are, and it's really the retinol that's a skin product that's widely available that can really enhance the skin quality in this particular area. Some patients, well, they just have too much loose skin, and that can come with facial aging and genetics. And lower eyelid blepharoplasty, also known as eyelid surgery, will really enhance this area, and what I term a skin pinch means taking away a small amount of skin beneath the eye can really improve these lines. But of course, there's so much delicacy with this procedure, because too much skin taken away can pull your eyelid down. So it is a very delicate area, and the surgery here needs to be very cautiously done. Fat transfer, well, fat transfer is a technique by which we take some fat from around your belly button, we concentrate that fat, and we put it in the areas of the face where there's been some volume loss. Now, under the eyes, often there is volume loss, and putting tiny amounts of fat transfer, not only does that improve the volume, But within your natural fat, there are regenerative cells, and these are third, fourth generation stem cells, which can improve the quality of the skin afterwards. So I often use fat transfer in combination with deep plane facelifting for patients with facial aging, not because it just adds volume, but it improves the quality of the skin and improves the result. And then finally, regenerative medicine techniques. And I've been pioneering a number of different techniques on PRP, AMP, and these techniques offer the way of using your own growth factors to heal the body faster, which ultimately is the way we see medicine evolving over the next decade. And so regenerative medicine techniques and advanced other oxygen therapy techniques can also improve these lines. So in summary, what causes these lines under the eyes and what can we do about it? Well, we talked about genetic elements and collagen and hypermobility. We talked about environmental factors such as smoking, and we talked about lifestyle, nutrition and hydration and how important those aspects are. In terms of skin products, well, there are certain things like retinol can really help, Botox for those dynamic lines, fillers where you may have lost volume, hyaluronic acid where your skin is thin, skin resurfacing, the gold standard being laser resurfacing, but in addition to that, peels can be helpful. Eyelid surgery, blepharoplasty, and a skin pinch under the eyes can be really helpful if you have excess loose skin. And of course, other techniques such as regenerative medicine can also be of benefit in some patients. So these are a couple of my own cases. This is a patient of mine who she had like loose skin around the eyes, and particularly when she smiled, she had lots of fine lines and wrinkles. And really it was a combination approach that really improved her result. And the combination was Botox for those dynamic movements, skin resurfacing using a CO2 laser, a gold standard to improve the quality of the skin, lower eyelid and upper eyelid blepharoplasty to take away that loose skin and millimeters of loose skin. And so really for some patients, it's a combination approach using all of these factors that's going to give the best result. This is another patient of mine, a lady who'd never had any previous surgery, very anxious about having surgery and looking too different. Well, a combination of eyelid surgery, also known as blepharoplasty, with laser resurfacing, with removing like a skin pinch, resurfacing the skin with laser. Well, it gave her a much more refreshed appearance, and really she looks more than 10 years younger as a result of this. And although it's quite a difference, none of her friends who she didn't tell could tell she'd had surgery. It's completely natural. And I certainly ask all my patients considering lower eyelid surgery to bring an old photograph of how they used to look, because I can use that as a template for the surgery to make sure you look just the same, but refreshed after surgery, not different to how you used to look. If you have any questions about fine lines under the eyes and improving them, if you have any other thoughts, please do not hesitate to contact me. I hope this information has been useful for you, and if you have any questions, do not hesitate to contact me. Many thanks for watching.